beginning. Okay, hey guys, today we're going to be talking a little bit about separation anxiety. So let me get to my PowerPoint. Okay, so separation anxiety, what is that? It's literally what it sounds like. It's when your dog has anxiety when he's separated from you. It can be seen with them being destructive, anxiety, crying, howling, having accidents in the house when you leave, chewing, digging, trying to escape, even hurting themselves trying to get out, eating poop, pacing, and getting anxious when you're about to leave. When addressing separation anxiety, depending on what symptoms you're seeing going on, each of those things I just said, they may not be separation anxiety on their own. For instance, a dog eating poop, that could just be from something completely different. But when you start having more than one of these issues together, that's usually a pretty obvious sign that there's some separation anxiety going on. I always suggest that you want to make sure to rule some of the things out. Like if your dog's having accidents in the house when you leave, and it normally is potty trained, you might want to check with the vet to make sure they don't have a bladder infection, or they're not having issues with just holding it from getting older with age. If they're starting to like chew and they normally don't, make sure there's not like there's something going on with their teeth, like especially with puppies when they start getting a little bit older, their teeth start hurting because they're about to lose their teeth. So that's from, could be from age. So always look at it objectively. Just make sure that it's not something else going on. But what causes separation anxiety? A lot of it's genetics. Just some dogs are predisposed to it. What sucks though is like they could have a they could be predisposed to have separation anxiety, but it may not show unless they have some sort of traumatic event in their life and it causes it to come out. So you could have a dog that has that, and then let's say they were surrendered to a shelter, that could trigger it, and then they would have separation anxiety after because they lost their owners. We see it in the shelter. You see it a lot when they're staying at the shelter because they're extremely stressed there. Depending on how long they're at their shelter, we may treat it. A lot of times we want to get them in a foster home first to see if it's shelter based or it's just stress related from there, or if it's actually an issue in the house. Other things that could cause it is like a change in schedule. You change where you live, changing the people in the house. It's not breed specific, and it can happen to all kinds of breeds, any size, any age, any of that. Let's go here. So if your dog has legit separation anxiety, it can be mild to severe. I had a dog that had extremely severe separation anxiety, and it was tough to deal with. Hopefully, if we got it handled, and we're going to go over on how to get to that, but if yours is more of a mild case, some of these other things I'm going to recommend might help stop it where you're at. So I should have did the slide earlier. So this was saying, does your dog have indoor accidents, behave destructively, all these things? It could be, if it's a combination of this, you could be having separation anxiety. If you've come home and see your crate like this could be it. If the dog is obviously under a year old, it could just be getting used to being crate trained. This also could be that they're just having issues with the crate. What I would suggest with this is take out that plastic liner in the bottom. If you're able to, set up a camera in there and see how they act when you're gone, because it could just be that they're just having confinement anxiety, which is different, where they just don't want to be confined in the crate. Sometimes if you just zip tie some of it, and if they're like generally sleeping when you're gone, then you're good, you're okay. But if they're crying the entire time and trying to bust out, or if you come home and they're injured being in that crate, then that's likely separation anxiety and not confinement anxiety. So with sometimes you can, like I was saying, if they're having issues in the crate like this, sometimes you can get different types of crates that will help combat this. This is like a welded crate. This is a couple different brands. You can get this on Amazon. This works for some, not all. When it's severe separation anxiety, I've seen actually my dog broke out of this. The top was welded, and he actually pushed him apart with his skull. He just would push it with all his head. He had a little big pity head. But for the most part, this usually works. He just was an extreme case. I've heard a lot of success stories with this brand. And then we've also used this. This is called a Rough and Tough. This works for, like, I would say moderate to mild separation anxiety. It's all plastic. In order to get out, they would have to really chew on that plastic for a really long time. For the most part, this works pretty well as well. This is actually what my dog did into my room. So there's a couple different things you could try. If you think it's just crate related, you could try to leave them out without being in a crate. See how they do. If this happens, then that's probably not going to work. And in my case, that was what happened. We were trying to try him. We had him in the welded crate, and he broke that. So then we were trying to see if maybe it was just crate anxiety. So we just left him in my room with the door closed to see, and then we came home to this. So then we realized this is a bigger issue, and just leaving him alone is not going to work. So you can also try medication. If it's clinical separation anxiety, you're likely going to need some sort of medication. A lot of people are surprised that dogs can take medication, but they actually do animal trials on this before it goes to humans, so it has worked on animals. Prozac is kind of, this is an anti-anxiety medicine. They take this daily. I find this helps a lot with any anxiety disorders. Trazodone, this is actually prescribed to people to help with sleep. It is also partly an anti-anxiety, but this is more as needed. They take it about 20 minutes to 30 minutes before going to the crate just to help keep them calm. Adaptable collars, this is like if you're having very mild symptoms, you can try this to see if this helps. It's a little bit more expensive than the Trazodone and Prozac, but the Prozac and Trazodone have obviously some more side effects, being as it's a clinical medication. It's not holistic. And then Calming Care is something new that Purina released. This is also kind of in the same field as Adaptil. It's a little bit more expensive than Prozac and Trazodone. A lot of times your vets will want to try the Adaptil and Calming Care before they go to the actual meds, just because the meds are more of like a last resort. If those aren't working, then they're going to have to really start getting creative. Sometimes they'll give Xanax, but Xanax is kind of the same with field as Trazodone in a way. It's more as needed. It's not going to treat it long term. But Prozac, if the dog is having like severe clinical separation anxiety, Prozac helps pretty well. Because that's a long-based thing. If for some reason you adopt a dog and they're on it, do not just stop them 100% off that Prozac, because they have to be weaned off of it. So if you start, your vet recommends it and you're doing it, you don't notice anything, don't just stop it automatically. You need to wean them off it. But it does take a month for that Prozac to start working. So if you do start giving your dog that, give them a month to see if it starts helping. The Trazodone, you'll be able to tell right away. Some other things you can try, if it's a possibility, try Doggy Daycare. When I worked at Doggy Daycare, we had a lot of dogs that would come in, especially dogs that are normally working dogs. We've turned a lot of working dogs into house dogs, so they have a lot of anxiety because they're bored, especially like with Aussies and Border Collies and all that. So a lot of them would come to daycare to help keep them mentally stimulated. It may seem like they're having separation anxiety, but they're just bored. So that's a possibility to combat that. It's going to take them to Doggy Daycare. If it is clinical separation anxiety, Doggy Daycare is actually good because they have someone to be with them. This is, of course, going to be more costly because you're going to have to do it every time you leave. But that is an option. And another option to explore is if you're able to either work from home or be able to take your dog with you to work. Like, let's say I knew someone that worked out of their car. They had to do deliveries all day, so they were able to bring their dog with them, and that was really good for the dog with his anxiety issues. Okay, let me go to the next thing. So if all of these things are either not working or just not an option, then you need to start going to the counter conditioning and desensitization for the dog. And this is some work, but it can be very effective if you go in the long haul. This is not something that you do one day and then it's done. This is something that you have to do over days, weeks, months, over and over and over again to really help the dog. Just like if you had some sort of trauma in life, you had to go to a counselor. One day isn't going to fix it. You're going to have to go over and over again. It's the same thing with dogs. So counter conditioning is basically helping get the dog to associate the leaving with something positive. One thing that they always recommend is downplaying your departures. This is something when I was younger I found out, and I thought it made total sense when you think about it, but you really shouldn't. I know we always want to say bye to our dogs and love on them, but that actually is that's increasing their stress levels, because if we do that every time we leave, they know that's a trigger, meaning they're leaving, and it's going to give them anxiety. So if you just act completely calm and act totally normal like you did any other time, then they may not necessarily know that you're leaving, because you're still acting just as if you did if you got up to go to the kitchen and left them in a bedroom or something. So I'm also going to post a handout in the event part of this that talks about all about the counter conditioning, because it's very, very in depth. I think it's a little bit too in depth for me to go over in just a video, but I will post that in there as well. So basically what you're wanting to do is you're going to do things like pick up your keys and then set them down. And you're going to do this all throughout the day. That way the dog doesn't know that, just because if you're only picking up your keys before you leave, they know that's like a sign saying, hey, I'm leaving. So you do this all throughout the day, so they know that doesn't necessarily mean you're leaving. Same thing with like putting on your shoes and getting ready, picking up your purse, taking a shower, all those things you have to do even if you're not leaving. And you have to do this over and over and over and over. When you kind of get to the point where they're not reacting toward those things, that's when you start doing gradual departures. So it's as simple as walking out the door for 30 seconds and then coming back. Then the next day you might stay, and then you're home the entire time the rest of the day. Then the next day you might stay gone for a minute. And as long as the dog's staying calm, you stay gone for that minute, and then you come back in. And then the next day you do it over and over again, to where you increase it to an hour, to 2 hours, 3 hours, so on. So if your dog is having really severe separation anxiety, if possible, if you could take off a week from work and try and really work on it then, because if you're having to leave at all, it kind of disrupts the process with those gradual departures. It's a lot of work, but it can work. With my dog, what we ended up having to do is, since I worked at the shelter, I started bringing him up the shelter, and I'd keep him crated in the room with me, just so he'd get used to the crate with me being in there. And I would leave, and then I'd come back. And I would say after a couple months of doing that, it actually got to the point where he was going in the crate on his own before I'd have to kind of really try to figure out how to get him in. He would run outside, and he would try and jump the fence to get away from me because he had so much anxiety. When he was in the crate, he was screaming, like bloody screaming. He would hurt himself to get out. He broke off 3 of his canine teeth trying to get out of the crate. It was really rough, but we did get through it. The number one thing is you just have to have patience, and you just have to keep working with it and going and going. Sometimes we see dogs get in return for that, and I totally understand if you don't think you can handle it, but I do want to say that unfortunately, by returning that dog, you're only feeding into those issues. So by you giving it off to another person, that person's just going to struggle with this a little bit more, because you're feeding basically into what that dog's anxiety is, that they're going to lose you. So just always keep that in mind. If you're really struggling, I really suggest hiring a trainer, because they'll walk you through all of this. So this is just kind of like a brief intro into what it is and how to help combat it. I'm going to post this handout. It's very in depth. It's really long, but definitely read over it if you're struggling with this. And if you have any questions, please let me know, because I have been there and I know exactly what it's like to go through it. That is all for tonight, and I hope you guys are enjoying your Saturday night at home. All right, thanks guys. Bye.